This is Dominique, who will talk about a soccer injury that she had. But first we're going to do a little work here, and I'm going to have you, Dominique, breathe in and curl your feet up to your nose, suck your cheeks in, blow your breath out, point your feet down, then let your feet and your breath relax. So the movement that I'm feeling here is really quite good. I just want to say that it's not 100%, but it certainly is lovely compared to what it was when we started a long time ago. How many visits ago? I don't know, 20, 30, something?
A bunch.
Yeah. So you may turn over. So Dominique's injury was that she was playing soccer and collided.
Flag football, actually.
Flag football, okay. And collided with somebody and then fell over backwards and landed hard on her head, but then someone ended up with their foot on her head as well. And when she eventually ended up in care of a neurologist, she was really unable to count backwards, pretty much at all. So this is really quite a change. And we'll hear more about that in a little while. So what I'm doing here is called sacro-occipital technique. I'm feeling these fibers here. I'm going to count to 7. 1, 2, 3, 4, 5, 6, 7. And when we did this way back in the first visit, there was a lot of tenderness there and nodularity, like a different like sense of spasm. Now I have to search for them. And did you feel anything this time, Dominique?
Nothing too bad.
Right, except maybe when I'm doing this now. Okay, and then let your breath go. Okay. And I'm trying to get the entire spine in balance so that we can make sure that it wasn't just the head in a sense that was injured, but it threw off Dominique's entire body. Cough, please. Okay. And then grab the top, take a deep breath, pull with both your hands. Let your breath go. Deep breath and pull, and cough. If anyone's wondering, I'm wearing this brace because I have a torn ligament. I'm able to get away with this using the brace. Right, you may turn on your back. So one of the things that of course occurred is because of the fall, it doesn't just injure the head but the neck as well. So right now I can feel that the 6th cervical vertebra is rotated out of place, which has shown up before. Bring up your arm here and let me just demonstrate this. So I'm going to push against your hand, and then when I press on that vertebra, it just gets weak. So let me just turn like this, just let those muscles go. I know, it's so hard to let them go. There we go. Okay, and now bring that arm up again and push here, and see now that's strong. Now, of course, those of you viewing the video can't really experience it, but I know Dominique does. The difference in the strength is really dramatic. The other side's good. Okay. All right, then I'm going to check the cranium itself. So here I'm turning the occiput, which then puts pressure on the junction of the occiput with the sphenoid bone. And I can feel that it doesn't move perfectly. It's a little bit locked in place, which is what we've been dealing with all along. And also when I'm pressing here, I should feel movement on the temporal bone, which is also, it's this whole side which is kind of locked in there. This side moves very nicely, and this one does not. And when I turn the occiput, I can get movement on the right side very little on the left. So I'm going to work with that. I'm going to work inside Dominique's mouth, and I'm taking a rubber glove. Open your mouth, and I'm reaching into a little bone called the pterygoid process, and pulling it forward. Breathe in. Good. And then, lovely. Okay, breathe in and out. Now let's see what happens when I feel that. There's movement there still, and there's movement here now. There's movement on the left now, there's movement on the right still. And that's the entire treatment. So, Dominique, do you want to sit up and talk about what actually happened in that injury and what your